Stress, weight gain, fatigue, disease, illnesses, and lack of activity, I'm here to help. In this video, part 2, I'm going to discuss supplementation, medical risks, disease and illnesses, strengths and weaknesses, and also stress and an exercise regimen for blood type O. Please go back and watch this video as it has a wealth of information in it. And even if you're not blood type O, it still has a lot of good information in it. Supplements. Type O supplementation should only be used when we cannot get it in our food, right? It's better to get it in our food. When we don't get the vitamins, minerals, and nutrients in our food, or if we need additional supplementation due to maybe having an injury where we need tissue repair or for extra protection. For example, if there's an illness going around, a virus, bacteria, colds, things like that. And then we might need some extra protection that helps actually supplement our food. The key to supplementation is to enhance our metabolism, stabilize our thyroid, and prevent inflammation. It's very prevalent with such things such as arthritis, and also to help with our blood clotting activity. We tend to bleed a little bit easier than other blood types. And let me say a caution here, a word of caution for those that are on blood thinners or have bleeding disorders. Please, please, please seek the advice of your doctor when you're taking any type of medication like that. Excuse me. It really doesn't matter what blood type you are, because you have to limit vitamin K and certain foods like that, green leafy vegetables, because they affect our clotting time. Let me also say that there are supplements that can be counterproductive and dangerous. And when taking a supplement, it's better to make sure that it's free of fillers and binders, because what can happen is we can have allergies or allergic reactions to those. It may not be the main ingredient, but the binder or filler can actually cause an allergic reaction. And it can also hinder the absorption of what we're taking in our body system. Let's start with beneficial supplements. And remember, these are only needed for the examples that I gave earlier. Otherwise, it's best to get your vitamins, your minerals, your nutrients, everything you need in your food. And that goes for any blood type, not just this blood type. So that's a general rule of thumb. You want to get it in your diet. That's the most important thing. Vitamin B is very beneficial due to us having a more sluggish metabolism. And research also shows that if we eat correctly, as far as B12 or folic acid, that supplementation is usually not required. However, there is research that shows that they have used these supplements to actually treat ADD, depression, and hyperactivity, and they use that along with a good exercise regimen. Also, those vitamins are responsible for the development of our DNA. The next one is vitamin K. It's not really a supplement, but it's a very crucial part, and it tends to lower our levels of clotting. So there's basically 8 clotting factors in the body, and that's a good thing. Foods that are rich in vitamin K are liver, egg yolks, green leafy vegetables, and that includes kale, spinach, and Swiss chard. Remember, extreme caution for people that are on blood thinners or have bleeding disorders. Please consult your physician. The next supplement is calcium. This is important for us because we're really limited on dairy products with this blood type. And dairy really is one of the best sources of calcium, and we tend to develop inflammation, joint problems, and arthritis. So consistent calcium supplementation is needed. Doses range between 600 to 1200 milligrams a day, and that is controversial, and everybody's going to have a different recommendation. But I think it depends really on our age, whether we're women or men, and also whether we're postmenopausal. And those of us that are understand that. I do want to add that if more calcium is taken, so here's the thing. When calcium goes up, when levels go up, magnesium goes down. And when magnesium goes up, calcium goes down. So when you take supplementation, and normally when you'll find it, especially a good supplement, it will be calcium with magnesium, and then it has vitamin D and zinc in it to help absorb it. So you need that for better absorption. Again, I'd like to add, it's better to get these in our food. And the best calcium-rich foods for this blood type are sardines, canned salmon, broccoli, and collard greens. The next supplement is iodine. And again, it's better to get it in our foods. And those foods include seafood, especially saltwater fish, and kelp or seaweed. Some will say iodized salt, but as we all know, salt has changed through the years, and they're finding all kinds of stuff like microplastics and other things in it. The reason this supplement is so important is because this blood type tends to have an unstable thyroid metabolism. We have a huge potential for weight gain, fatigue, and fluid retention. And honestly, thyroid supplementation is not recommended and really should be gotten in the foods that we eat. So that's really important. So now let's talk about licorice. Due to our high stomach acid levels that lead to peptic ulcer disease, ulcers in the stomach, and stomach irritations, inflammation, etc., this is really a good supplement. Some call it an herb or say it's a food. There's a licorice, and this is really the one that you want to take, is called DGL. And you can get it in a powdered form, or you can get it as a lozenge. And it actually heals the stomach lining, and it protects it from, the stomach acid production that we have more of in this blood type. I'd like to say also to be careful on which licorice you buy, because some of them can elevate people's blood pressures. And we see this especially in the Black American population. And they tend to, if they don't have the right licorice, it can tend to cause more hypertension. And I just want to add something about the healing of the gut. I had issues with it for at least 6 months. We had lost a family member, my brother, and I was being verbally abused at a supervisory job that I had. And went to the GI doctor. We tried all these things weren't working, and I had done some research on bone broth. Bone broth will actually heal the whole digestive tract from the mouth all the way down to the anus. It will heal it. It has got collagen in it, so if someone has leaky gut, it'll help heal the lining of the GI tract. And so if you're having GI issues, I would definitely recommend bone broth. I was drinking, and I was on a liquid diet right then. I couldn't chew because when I was told what happened to my brother, I was eating. So I couldn't really swallow well for about 6 months. But I was drinking 2 cups a day, 3 times a day, and it actually healed my stomach. And I wasn't on those proton pump inhibitors and those things. If you read the cautions on them, they can actually cause ulcers and bleeding. So word of caution there. And then for people that have taken antibiotics, because antibiotics actually ruin the immune system in our gut, and it really takes a long time to build that immune system back up. It's true, it really takes a long time. So I believe that, bone broth is one of the solutions, obviously pre and probiotics and things like that. But I just wanted to add that as a side note because I personally experienced it. I know a lot of people that have had GI problems that I've educated on this and that have done it for themselves, have had really good results. So, it's helped them. It doesn't matter what their blood type was. They got good results with it. Bladderwhack. This is actually a seaweed, and it really does help in protecting the intestinal lining, especially from ulcers caused by the bacteria H. pylori, H-P-Y-L-O-R-I. It's very, very common. When I worked GI and in the GI lab and we were doing endoscopies and all of that, it was very, very common. But the cool thing about this herb is that it actually, it clogs the suction cups on this bacteria, and it clogs those suction cups, preventing it from attaching to the stomach, the lining of the stomach. So that's great. And then the other thing, it aids in weight control, and especially those who suffer from thyroid issues. So it's really a great herb all the way around. All right, let's look at supplements to avoid for this blood type. One is vitamin A. It can enhance our blood thinning, and you can also get vitamin A poisoning. This happened to me when I was younger. I had terrible menstrual cycles, and not knowing what I know now, I actually ate, it came in boxes back then, 3 boxes of spinach, and I was not doing well and went to the hospital, and they checked, and I actually had vitamin A poisoning. So it's something you have to be really careful with. I mean, just because it's a vitamin doesn't mean it's safe. It's just like medication. It's everybody's an individual, and you have to see what works best for you. But you can get it in your food. Foods that do have vitamin A in them that are acceptable for this blood type are yellow, orange, and dark green leafy vegetables. And the last one is vitamin E, and it's also due to how it slows down our clotting times. So we need it to clot. So we don't need to supplement. I've done it before, and I noticed that if I go to shave my legs, I'll bleed a little bit more. So I stopped all that. But there are acceptable foods that have vitamin E in it, and it's better to get it in our food. And those are liver, nuts, leafy green vegetables, and vegetable oils. Okay, now let's talk about the medical risks, the disease and illnesses that are prone to this blood type. Obesity and being overweight can be common for any blood type. It doesn't matter what blood type you are. But if you're eating the right type of foods based on your blood type, and you have the right nutrition, it shouldn't be a problem. Actually, you'll lose weight and you're not even trying to lose weight. But there are so many medical issues for people that are overweight and obese. And one of the first ones is, and it's rampant, is diabetes. And it's so common, it really doesn't even matter what blood type you are. I think a lot of it has to do with the American diet, but eating the right foods for our blood type will definitely help. Weight control is really not hard to accomplish. It really isn't. It's fairly easy when you follow this. When we're eating the right foods based on our blood type, and of course there's exceptions to every rule, but I just want that to be an encouragement to everyone that struggles with weight, because it could be thyroid issues, it could be numerous things. As I discussed earlier, inflammation is a big problem for type O, and it includes, joint pain, different types of arthritis, and it's very, very common. So we have to, dairy seems to be the culprit for me, and I think for most blood type O with that. Again, mentioning diabetes, and that's related to insulin resistance, blood clotting disorders, low thyroid production, peptic ulcer disease, asthma, hay fever, and allergies. Also, anxiety, depression, and bipolar disorder are more prevalent in this blood type for some reason. All the research shows that we tend to have more anxiety, depression, and or being bipolar. On a positive note, we are less likely to have coronary artery disease and also certain cancers. And I know there's typos that have heart attacks and all that, but it's probably related to stress and the way we react to stress, and also how we eat. And a lot of people smoke, and so there's other factors. So let's get to stress and an exercise regimen, and this is really important. One thing I would like to say about stress is that we all have it. And it's not only the food that determines our health and wellness, but it's the way that we react to stress. And the way we react to stress affects the way our body uses those nutrients, right? So it's our reaction to stress because we all have it. Stress is more common today than ever before. You know, you'll hear people say, I'm stressed out, or, you know, I've got too much stress, I'm under too much stress. But the truth really is, it's not the stress itself, but it's the way we react to it. And so that's where exercise, I mean, food's definitely a part of it, but exercise really comes in. As I said before, it's not really the stress itself, but our reaction to the stress, and that can actually deplete our immune system and lead to illness. So you can have a strong immune system, but if you're reacting to stress in a negative way, you're going to get sick. More recent research studies show that stress is related to 85 to 90% of diseases and illnesses today. I think it's higher than that. I think on a lot of death certificates, it should be stress because it causes hypertension and diabetes and all these other issues. But the research says 85 to 90%. It destroys our immune system, and it actually leaves our bodies open to opportunistic, health problems. So, that's the bad news. The good news is that studies have shown that different forms of physical activity or exercise for different blood types actually help us cope better with our response to stress. And that's what I really want to speak about here, is our response to stress. I could speak about the fight, flight, or freeze response that occurs and how it affects our body and our hormones and our adrenals and really every single cell in our body. But that would be a video all by itself because it would be very lengthy. So what type of exercise is critical for this blood type and why? Well, we require a regular intense exercise program, and it's just what we require. Things like aerobics, swimming, jogging, weight training, stair climbing, martial arts, bicycling, roller skating, anything that is intense and it gets our heart rate up and that we're sweating, that's what we need. And I know for a fact that's what we need. Exercise should be done a minimum 3 to 4 times a week, and the length of time will range on the exercise, but anywhere from 30 to 60 minutes, depending on, like I said, whatever exercise or activity you decide to do. And there's other activities that are strenuous. You can, you know what they are. And the benefits of this is that not only will it lift our spirits, but it also helps with what we're prone to mentally, like anxiety and depression and emotional health. And the other plus on this, or bonus, is that it also helps with weight control, along with eating the proper foods in our diet and everything. And when we don't have this appropriate activity, we're usually overwhelmed during what they call the exhaustion stage of the stress response. And everybody has an exhaustion stage of the stress response, but I'm speaking specifically about type O now. And if there is no change, we are vulnerable to inflammation, autoimmune disorders, weight gain, obesity, mental health disorders, and things like that. So it's really important that we get that. It's it's holistic. It's body, mind, spirit. It's not just body. It's everything. I would like to say that I am this blood type, and I have followed this nutritional plan and exercise regimen in the past. And I follow it pretty well now, but not as much as I should. And I will say 100% that I have felt my best, done my best, thought my best, everything when I was following this. So I can definitely attest to it. I've also coached others the same exact way, and I can say that the results were really positive. Another bonus is I had lost 17 pounds, and it wasn't that I was heavy. There was a little extra weight on me, especially around the middle, but I wasn't even trying. And I was eating. I wasn't hungry. I wasn't starving. I was just eating according to the highly beneficial, the neutral, and trying to do the avoid, and then doing the exercise program. And speaking of exercise, please remember that when you're exercising, that you really need to warm up and do some stretching. You want to warm up the muscles and take the time to do that, because it will prevent injuries, which we don't want, because then we can't exercise. Also, alternating isometric and isotonic exercises is very beneficial. One place I worked, I was actually working with an exercise physiologist, and she was over here at Jacksonville working with the military personnel, the ones that got up in the planes and, go hit Mach 1. And she told me, that it was really, really important not to do total body workouts every day, because that's what I was doing, and I was actually muscle wasting. So you work different parts of the body on different days, and use caution. Start out slow if you haven't exercised in a while, because you'll feel it if you'll know. And I do have to say this because I am a healthcare professional. But please consult your doctor if you've got any questions or on certain things that, maybe you need supervision during your exercise regimen to start out with until you get started. And then once you get in better shape, you can do it on your own. And remember, the goal is to counter stress with action. And the best antidote to depression and fatigue is actually doing the work, the physical work. And the thing is, you can make it fun. It doesn't have to be something like, I got to exercise. You don't want to feel like that. You want to get up and go. And I know that the more I did it and do it, the better I feel and the more I want to do it. I guess, the bottom line is, in the end, your stress levels will be reduced. Your mental health and your mood will be improved for sure. And you'll have what some call, renewed energy. Simply put, I just call it a healthy type of energy. It's not an anxious energy. It's not an anxiety type of energy. It's a healthy energy. So this completes the 2-part series, and it had to be 2 parts because there was a lot of information here, and I just couldn't get it in one video. It was just too much. But if this video was of interest to you, it helped you, or maybe helped someone you know, or you shared it with someone, please like and subscribe. And don't forget to hit that bell, because the next video I'm going to do is going to be starting with blood type A. And it'll be kind of like the same thing. I want to thank you so much for watching and supporting this channel. I really do appreciate it very, very much. The other thing I want to mention is if you would like to enter to win a free wellness consultation with me, it's valued at $299. It's free. Follow the instructions in the description, and everything's confidential. I follow HIPAA precautions and guidelines and all of that, so no need to worry about that. This is Nurse Kathleen, and I'll see you in the next video. Bye-bye.